So you want to know if skin cancer can be easily cured with topical treatments. Well, in this video, we're going to learn all about superficial skin cancers and whether or not they can be easily cured with topical treatments. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health, so you can be informed and in control of your medical needs. If this is your first time on the channel and you like to get fact-based healthcare information, please hit the subscribe button for me. By the way, HEALTHdrum is for educational purposes only and not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. Okay, so let's get into it and start sorting fact from fiction. So superficial skin cancers are extraordinarily common and easily cured if caught early. And we're really talking about superficial squamous cell cancer and basal cell cancer. Let's have a look at basal cell cancers first. So this particular skin cancer starts in the basal layers of the skin, which is the lower part of the epidermis, which is the outer layer of skin. So the basal cell skin cancers are the most common type of skin cancer found. Usually very slow growing, rarely spreads, highly curable, and although recurrence is possible, it is easily treated and retreated. Now let's look at superficial squamous cell skin cancers. So like basal cell skin cancers, squamous cell skin cancers are also extremely common and highly treatable. They can spread if untreated, and they are highly curable, and recurrence is possible, but the recurrences, whether in the same area or in a new area, can easily be retreated. So you've been to the doctor before and had these areas biopsied and treated, and you have recurrent areas and you want to know, what can I do to treat these myself? Let's first look at those medications that require a prescription. Imiquimod is a cream that can boost your immune response to help the body destroy this cancer cell, while 5-FU targets abnormal cells to destroy them. 5-fluorouracil is a chemotherapy cream that is effective for superficial skin cancers and actinic keratoses or precancerous lesions. These treatments are applied periodically for several weeks and can cause some redness, peeling, and irritation. You do need prescriptions for these costly topical treatments. So recurrent superficial basal cell and squamous cell skin cancers are extraordinarily common, and you want to know, is there some self-care option available? So high-strength hydrogen peroxide is available, and the strength is somewhere between 33 to 40%. It's important to realize it's not the same hydrogen peroxide that you can buy at the local drugstore. High strength you buy online, it will last you several months before you need to replace it because it slowly degrades. It's a powerful disinfectant and antiseptic and is relatively inexpensive and ideal for self-care. So how does 40% high-strength hydrogen peroxide treat superficial basal cell and squamous cell skin cancers? So hydrogen peroxide has been found to cause cell death through oxidative stress, apoptosis, autophagy, necrosis, and ferroptosis. You can read more in the references in the description below. So if you check the references below, you'll see that there's enough proof of concept that topical 40% hydrogen peroxide is effective for superficial basal cell and squamous cell skin cancers. How's it done? Well, you can use cotton balls or Q-tips, soak them with the 40% hydrogen peroxide and apply to the area in question 2 to 3 times a day for 45 to 60 seconds each time. You will feel some mild stinging after 10 seconds or so, and this discomfort can last for several minutes. You will also see some white changes or blanching of the area treated. You will do this daily till the lesion fails to react and disappears. Usually only several days of treatment are required. So let's see some pictures of how the high-strength hydrogen peroxide is applied to superficial squamous cell cancers on the face. So here's a picture of the supplies, the container with the high-strength hydrogen peroxide, a smaller container with a dropper to drop the peroxide into the cotton ball or to the Q-tip. The next picture shows a cotton ball applied to the area on the forehead, and the last picture shows some blanching sort of changes that are typical after treatment of the cancerous area with high-strength hydrogen peroxide. So are there any cautions about using high-strength hydrogen peroxide topically? So there are some cautions with using topical high-strength hydrogen peroxide. Do not use it if allergic to it. This is highly uncommon. Do not ingest, do not inhale, do not drop into the eyes, and do not swallow any significant amounts. Also, hydrogen peroxide can degrade. That's why it's kept in a light-resistant container and usually lasts for some 6 to 7 months before usefulness drops off and you have to repurchase another container. So are there any potential side effects or complications from using topical high-strength hydrogen peroxide? So there are some possible side effects from using topical high-strength hydrogen peroxide, such as temporary stinging discomfort, temporary irritation and redness, temporary itching, rash, hives, or blistering, and very rarely a low possibility of scarring or pigment issues. So what is 40% topical high-strength hydrogen peroxide FDA approved for? So topical 40% high-strength hydrogen peroxide is FDA approved for the treatment of seborrheic keratosis. So what is the proof of concept clinical evidence that 40% high-strength topical hydrogen peroxide can successfully treat superficial basal cell skin cancers and superficial squamous cell skin cancers? So 40% topical high-strength hydrogen peroxide has only been FDA approved for the treatment of seborrheic keratoses, but clinical studies have shown that high-strength hydrogen peroxide was also effective for treating skin tags and for treating small recurrent superficial basal cell and squamous cell skin cancers. And there is also a report where bigger basal cell cancers were downsized with topical hydrogen peroxide applications prior to surgical removal. Now, the references to this and other material about high-strength hydrogen peroxide are in the description below. What about other lesions, such as lesions in the mouth or on the tongue? So my colleague had a lesion on the tongue which was biopsied and diagnosed as leukoplakia, this particular type precancerous. However, he wanted to explore an alternative non-surgical option first and found reliable information about high-strength hydrogen peroxide. He applied a Q-tip soaked in high-strength hydrogen peroxide to the area in question on his tongue 3 times a day for at least 45 to 60 seconds at a time for several days. As well, he used a mouthwash of diluted hydrogen peroxide for several days. After a few days, the lesion disappeared and couldn't be found by the doctor at a return visit. So because of the obvious usefulness of topical high-strength hydrogen peroxide to superficial squamous cell skin cancer of the face, it may be useful to explore its use for other types of squamous cell cancers in other parts of the body. So because there's evidence that topical high-strength hydrogen peroxide can successfully treat superficial squamous cell cancers of the skin, it's reasonable to wonder whether it could be useful for other disorders such as superficial mouth and tongue lesions, genital human papillomavirus, superficial squamous cell cancers of the penis, cervix, and of the anus. So let's recap. In this video, can skin cancers easily be cured with topical treatments? You learned that superficial squamous cell and basal cell skin cancers are extraordinarily common. They commonly recur, and that topical treatments are very successful. To learn more about routine medical conditions, self-care, and digital health, check out these other videos.